My name is Carl Van Horn. I'm a professor of public policy and director of the John J. Heldrich Center for Workforce Development at Rutgers University in New Brunswick, New Jersey. For many years, we've been following workers in the United States, doing national random samples of them. And during the recession, of course, we focused on those people who'd lost their jobs. And so what we have is a really deep picture of what's happening to people during this recession. Unfortunately for older workers, it's a bit of a bigger problem than it is for younger workers. Of course, it's bad for anyone when they lose their job. But with older workers, we find that they face a steeper climb to get back in the labor market and to recover financially. Of course, this recession's an equal opportunity punisher. I mean, it really has hurt people at all levels, young and old and in between, in all sectors, in all regions of the United States. And so that's why it's so particularly painful. But the kind of the interesting point about that is that all of these structural changes have been going on in our economy for a long period of time. So these are just the peak, really, of some of those problems. So we've had mergers and acquisitions, consolidations, restructuring, and downsizing, outsourcing. All those things have been going on for quite a long period of time. So it's not like suddenly these things started happening. It's just that we're more aware of them because the ability of a person to reposition himself or herself, which would have been the case in 1998 or 2000, is no longer as available. And then the other thing is it has spread beyond certain regions that we used to think were recession-proof in certain sectors. So IT seemed to be growing forever. It wasn't. It obviously hit a roadblock. Healthcare industry, which is strong nationally, is not necessarily strong in every region. So, for example, the nurse who loses her job in Milwaukee suddenly has got a house that she can't sell. If she could move to New York City, she could get a job, but maybe she doesn't want to, and it costs a lot more to live here, et cetera, et cetera. So there's also those geographical problems where there's a mismatch between where people are living and where they can go to. So all of these problems cut across the region. It's just that when we're talking about older workers, they face, I think, an additional burden, which I've spoken about before, of lack of mobility, lack of opportunity for education and training, and whatever stigma may attach to them, fairly or unfairly. It's a little complicated, but if you're an older worker, you're somewhat less likely to lose your job in the first place, right? But if you lose your job, it's much harder for them to get back in the labor force. If they do get another job, they're likely to take a big pay cut. So, for instance, we know that about the 2 million people who are older workers and unemployed today, what happens is they're likely to stay out of work probably 3 or 4 months longer if they do get another job than a younger worker. And then if they get that other job, they're going to take, on average, about a 20% pay cut. Whereas the younger worker, when he or she returns to the labor market, is more likely to get a 2% pay cut. So again, they've lost income during that time, but when they get back in the labor force, they do better. So they face a very difficult problem. And then, of course, older workers, when they get back, don't have as much time to make up what they've lost. They've also gone through savings and other things just to keep themselves together, and then they're going back and have a short period of time to prepare for a reasonable retirement. Above 50, there's several million. There's a couple million over 55, and there's probably another million or so between 50 and up, because where you draw the line as to an older worker is arbitrary. There's no official government definition of what an older worker is. And in fact, I certainly have talked to people who say they're an older worker when they're 35. So, it really varies. But I think we tend to use 55 because there's some federal laws that define that as an older worker. They're a decade from the traditional retirement age. First of all, some of the industries they're in happen to be ones that have taken a big hit in the American economy, mainly manufacturing, which it's been a long-term decline, but it's continuing. The other is construction. Both of these are very much male-dominated professions. Not that women don't work in them, but they're more men than women. The other reason is that their skills may have atrophied. They may have lost the capacity that they had when they were younger. Maybe it's physical, maybe it's technical, but their skills have been eroded somewhat. The other thing is that when you're an experienced worker, of course, the company where you've been working tends to reward and appreciate that experience. When you go to a new company, they don't necessarily know that you're a really good worker, and they don't always appreciate it. And then the last hurdle that older workers face, I think the other main problem, is that there is a stigma attached to some older workers. That is to say, some employers will look at them and say, it's something you can't hide. I mean, you can tell if you're an older worker. You don't have to ask any questions. You just look at them, you look at their resume. And so they say, look, this person may not work as long, so the investment I make in training isn't going to pay back. Perhaps they're not as likely to be physically fit for the next several years, so maybe they have bigger health problems, so our healthcare costs are going to go up. So there's a lot of that stigma that attaches. It's not necessarily fair, but it's something that we see quite often. One of the problems that older workers face is that when they've been in the labor market for a long time and they haven't been looking for a job and then they lose their job, is they don't really know how to look. They've lost that capacity to look for jobs, so they face some of that difficulty. Also, they're perhaps not used to using the internet and other social media strategies that a lot of companies rely on now. Again, they're not hard to learn, but again, they're just out of practice. The other way in which people get jobs is by activating their personal network. Now, it may be that if they're in a plant closing or in a community where lots of people have lost their jobs, they don't have a network to rely on. And then in this particular recession, we have the additional problem of the rapid decline of the value of their home. Therefore, they're not mobile. They can't move. They may not want to move. Maybe they have other reasons, but financially, it's very difficult for them to sell their house at a great loss and give up that nest egg they were planning for a retirement. So there's a lot of things that make it harder for older workers to look for another job. And again, a lot of them also report to us the feelings of embarrassment, the difficult hurdle of facing a rude recruiter that they haven't faced for a long time. Younger workers will tell you that they're kind of used to this. They don't expect reciprocity. They don't expect a lot in return from the people they apply to for jobs. But a lot of older workers aren't used to that, and they get upset, discouraged. That may be cause them to withdraw, really, and that's the worst thing you can do if you're unemployed, is to withdraw from the process. I think it makes some difference that they're not able to use social media as well as younger workers. A lot of employers rely on Facebook and Twitter and other LinkedIn and other strategies, and lots of individuals rely on those to help network themselves into a job opportunity. So if you don't have those skills, or you've this completely foreign to you, then that puts you at somewhat of a disadvantage. I wouldn't say that's the main reason, but it's an example of some of the problems that older workers face when it comes to looking for work. I think the more important point is what's in the heads of the employers rather than what's in the mouths of the workers looking for a job. In other words, their attitudes about unemployed workers in general, their attitude about the current labor market that we're talking about now in 2011, which is still a very bad labor market, they're very much in the driver's seat. It's a buyer's market, okay? So they look at this person across the desk from them, or looking at the resume, and they say, well, yeah, maybe they'll take a lower wage, but I can get 2 workers for the price of 1, or I can get this other worker who doesn't have this expectation, who isn't going to be disgruntled 6 months from now, etc. And all those other images that plays in their head. Now, of course, they don't apply that to themselves, the person, the employer making the decision. They say, well, of course, that's not me. But when they're looking across at a person who's an older worker, not all employers, but a number of employers will attach those sort of negative perceptions. So I don't think it's so much on the problem of the older worker looking as it is what employers think about that, and the fact that there's 5, 6 qualified applicants for most jobs, sometimes hundreds. So, you know, it's inevitable that they're going to try to find the least expensive qualified person that they can get who they think will stay with them for a long period of time, even though you're right, there may be turnover very quickly. I've been studying labor markets for over 35 years, okay, even though I look like a teenager. You know, I've been doing this a long time. So I have seen the ups and downs and back and forth of a strong labor market, a weak labor market, and everything in between. So when you have a very weak labor market, which is what we have right now, every obstacle that an employer can look at will be looked at. Did they miss a credit card payment? Did they ever default on their mortgage? Have they moved too frequently? Et cetera, et cetera. Are they too old, in my opinion, in our opinion? So all of those become filters. In a strong economy, which we had slightly over 10 years ago, people would be hired for jobs as long as they didn't have a serious felony offense. Okay, so that is part of what happens, and there's not a lot that can be done externally. We don't have laws in this country, and I wouldn't predict there will be laws in this country that ever require employers to hire particular kinds of people. We may give some incentives to them, we may help, we may encourage, but it's not in the tradition of American labor market policy to require hiring of any sort of individuals. It's only in the negative if we can prove that you've deliberately discriminated against an older worker, a woman, a minority. Then there can be a penalty potentially imposed after the fact. But on the way in, we do not require this. And if you think about it for 2 seconds, the hundreds of thousands of employers in the United States, even having the enforcement of such a law would be virtually impossible. There's never been a strong law in this country about that. It's especially hard to prove age discrimination. And so that's why it's not denying that workers feel that, and whatever you want to call it, if you take the discrimination label off and just say employers have a very strong preference for a younger worker, I think that's clearly true. Is that discrimination by legal terms? I mean, we'll find out as cases go forward. But I don't think the laws are fairly weak in that regard. And so it really puts the burden, as it often is, on the person seeking the job to figure out how to break through. And that's a problem which is not easily solved. And in a very bad economy, which we have right now, the longer you remain unemployed, the harder it is to reconnect. Because again, a different kind of stigma attaches to you, which is what's wrong with the person who hasn't been able to reconnect. Now, by the way, we asked American workers that very question, why they think people are unemployed, and is it because they're not trying hard enough, et cetera, et cetera. And overwhelmingly, Americans say it's not the fault of the victim of unemployed, the person who's unemployed. It's not their fault. But that's not employers. Employers have a different attitude. In fact, you've probably seen that there's some companies that have advertised they will not hire someone who is currently unemployed, which is clearly unfair, but there's nothing in the laws that say they can't do that. Most training programs get assessed, or they assess themselves on the basis of, did the person get a job and did they increase their wages? Because the idea of training, of course, is to bump up earning capacity. With an older worker, we know on average they're not going to increase their earnings. They need to get that training just to get another job. So for many training agencies, there's a real disincentive to serve them because their failure rate is going to be higher. So it takes a somewhat more courageous organization to say, we are going to do this, they need this help, and we can explain it to the people that are funding us. So actually what you find is some of the nonprofit organizations, and those are funded by philanthropies, more likely to take that risk. The other point I'd make too is that the size of the older worker unemployed population is large, so is the entire demand for services. So again, those agencies make some of the same choices that employers make that I referred to earlier. Well, where am I going to put my investment? They don't have enough money to serve everybody. So unless they have a particular passion or interest or whatever you want to call it for that older worker population, they may say, well, I'm going to put the focus on the middle-aged worker who still has children living at home, or a person who's even lower income, etc. So these are the tough choices that government agencies and social service agencies have to make every day. They can't serve everyone, and so inevitably they make some choices. I think often those choices do not help older workers because of the fact that their needs are actually greater, and perhaps it's not as well recognized. I would say the jury's still out on the Older Workers Initiative of the U.S. Department of Labor. It's partway into its effort. They've made some preliminary recommendations. But I think the broader point is that as we're speaking today in April of 2011, the trend in Washington actually is to decrease spending on social services. There was a big cut already taken by the President and the Congress in this fiscal year that cut back on money going to some of these programs. And even unemployment insurance has become somewhat more controversial at the federal level as the attention's focused more on deficits and less on stimulus, on putting more money to solve these problems. So inevitably, I think we're going to see resources declining to support some of these individuals, which is unfortunate, but I think that's the trend right now. So in the short term, it isn't so much the quality of the recommendations, although we need good recommendations, but I think we're going to face diminishing resources where the need continues to be very high. Well, there's a couple of things that are happening in terms of the large social insurance programs, neither of them positive. One is that people who are entitled to disability insurance apply for disability insurance and get it. In other words, they're qualified, whereas before they wouldn't because they were working. And being qualified for disability doesn't mean you can't work, but it does mean that if you choose not to, you can still get the benefit, right? So there's been a big increase in applications for that. The other thing that's happened is an increase in people taking Social Security benefits at the earliest possible point, which reduces the monthly benefits throughout your lifetime. So those are both problematic. Now, obviously, not criticizing the people that do it, but from a fiscal standpoint, they're a problem. Most of the solutions in terms of solving our long-term deficit and our problems with Social Security relate to getting people to work longer. But in fact, people may want to work longer, but they find that they've been out of work for a couple of years, they're not able to do it. They're 62, 63 years old. Currently, they could apply for it and get Social Security benefits if they go ahead and do that. But it's important to remind everyone, Social Security benefits is not a bed of roses either. It doesn't, for most people, provide enough money unless you own your home and you have very modest expenses. You're probably going to need something else to be reasonably comfortable in retirement. And then you're still waiting for Medicare, which doesn't kick in until age 65. Less than a third of the people we started interviewing a year and a half ago actually found a full-time job. So that tells you how difficult it is to get back in. And that's not just older workers, that's all workers. But older workers have a somewhat more difficult time. More like 1 in 6 were able to get a full-time job. So that's a picture of really difficult unemployment for older workers, and the solutions to it are, besides waiting for the economy to get better, which is not comfort to anyone who's unemployed, is really to try to get the resources mobilized in communities to deal with the person's holistic problems, whether it's health care, food, housing, and so on, because otherwise we're going to experience an uptick of impoverished older Americans who have gone through their savings, who owe money to lots of people that they can't pay back, who may eventually, in the worst case scenarios, become homeless. And I think this is a silent problem that people are not really focused on. that we need to address as a nation. And unfortunately, like many problems, when it becomes a crisis, when it becomes widespread, then we'll probably do something about it. We ask people whether they think that the economy is in a temporary downturn or a fundamental lasting change, and the majority, I think it's almost 60%, believe it's a fundamental change, and so do their children. I mean, so does the generation behind them. And that's a very important point. The intergenerational question is that as older Americans, those who are unemployed and remain and lose income and so on, they're going to turn to their family, to their children. So it's going to be an additional burden on them to try to cope with their parents, who hopefully they will help, when they're trying to raise a family and take care of their own financial obligations. So it's another boomerang effect, really, of this recession. In addition to the other health effects I referred to, the increase in depression, anxiety, substance abuse. I mean, these are all pathologies associated with bad economies, but as I've been talking about, it tends to be concentrated intensely, really, in this group of older Americans who are very long-term unemployed and can't get reconnected to the labor market, not through any fault of their own, but because of the structural problems we've talked about. And then the fact that they are not eligible for social services in many cases. They're not quite old enough for Social Security. They're not old enough for health care insurance. And so where do they turn? They turn to their family, they turn to whatever social services are available in their community and try to get by that way. The only bright spot I see, really, is that when I talk to unemployed workers and older workers, is that they're plucky and they have incredible persistence. Now, maybe that's the one who tend to, although we also talk to people who've had a very tough time, but I'd say overall what I see is people who are very resilient. That's not to take away any of the problems I referred to. I mean, there are many people who can't be resilient in the face of these difficulties. And access to mental health services and other things, I think, is another problem, which I've alluded to indirectly, but I think that's an issue as well. One of the things I always like to remind people is that the labor market is constantly turning over. And the best thing you can do, even when you have the darkest moment, is to make that extra phone call, to put in another application, to try again, because it, to some extent, is a random process of connection. And the greater your odds are, the greater the ability to connect are based on the odds of your continuing to socially network, to volunteer, to do whatever it is you can keep yourself in the mix. Sitting in your home, worrying about it, watching television, doing whatever, is not going to get you another job. So it's getting out there, meeting people. That's still the best way to connect, whether it's in your church or synagogue, or whether it's in a community group, wherever. Volunteer, stay involved, work part-time, do whatever it is to get yourself connected, because you never know when that next opening is going to come up. Even while the economy is in bad shape, there's still millions of openings every year.